Norwegian Red Cross has been present in Pakistan since 2014. So therefore, we were already present in KP province already and tribal districts. So we were able to immediately scale up and support during the flood hit. We have already started, maybe aware the flood catastrophe came seriously in August-September period, but however we were able to mobilize some of the resources, existing resources, to address right from July initially. But however, over the periods, because of the extensive damage it caused, now currently we are conducting 7 mobile health teams, reaching up to now reached more than 100,000 OPD consultations. And also we are distributing some non-food items, reaching more than 14,000 households. And our MHD is comprehensive, which has a comprehensive services including psychosocial support for those emergency affected people. In addition, we are also providing household latrines in terms of wash aspects. And overall, now we are even started supporting Sindh province as well, in addition to KP province. Actually, since we started the emergency operations in KP province, we have realized there is a huge gap existing in the community engagement and protection, gender and inclusive aspects. So we wanted to integrate in our activities. So we have given focus onto that. And Norwegian Red Cross, as you may be aware, like other Red Cross partners, we focus on PGI components and CEA components. So we wanted to make sure communities are happy and also their needs are addressed and our interventions are appropriate for the community needs. So those are the things which we wanted to focus, and in addition to our aid. So that is why we have started supporting even the provincial and national level headquarters for human resource support for those components.
शुक्रिया जाको अस्तास ढेर ढेर शुक्रिया तस सर अल्लाह ढेर खो की अल्लाह की इज्जत दर की
Definitely Norcross is lucky and happy to be a partner of PRCS. The PRCS, we have seen one of the humanitarian organization which reached the people at the right from the beginning of the emergency. And the unique specialty of Pakistan Red Crescent, I have observed, is the reaching the most hard to reach areas. Especially the place where we are delivering here for the second time. We are delivering NFIs in this area. I think this is one of the toughest areas to reach for anybody. This now the emergency appeal and our contribution officially started from last week of August. Now we have completed 6 months. So by our interventions after March, end of this month, we will be moving towards early recovery, especially targeting health facilities and community level wash infrastructure support. So we will be focusing more on health early recovery assistance.
मैं तो शुक्रगुजार हूँ स्पेशली जो है हमारे ICRC का और फिर स्पेशली नॉर्वेजियन जो है वो हेल्थ में हमारे साथ पार्टनर है और वो जो है भरपूर हेल्प कर रहे हैं और हमें जो है हमारे जितने भी हेल्थ प्रोजेक्ट हैं इमरजेंसी रिस्पॉन्स इसमें जो है वो हमें मदद दे रहे हैं। मैं उनका भी शुक्रगुजार हूँ। और देखें हम इंशाल्लाह फ्यूचर में फिर हमारी सिर्फ ये नहीं है, हमने कम्युनिकेशन जो हमारी जो तबाह हुई है, रोड्स वगैरह तबाह हुए, जो वाटर सप्लाई किसने जो है वो तबाह हुए, हमने जो है जो लोग घर डैमेज हो चुके, तो इंशाल्लाह ये रिहेबिलिटेशन का जो दूसरा फेस आएगा इन सब में हम इनको भी हम फोकस करेंगे और इनको भी जो है हम रिलीफ देंगे।